Welcome to our deep dive into social anxiety in young people.
Uh-huh.
We're going to be looking at a book called Social Anxiety and Social Phobia in Youth,
Okay.
written by Christopher A. Kearney, who's like a, big-time clinical child psychologist.
Right.
And I think for our listeners today, we really want to take a deep dive into what's the difference between just being shy and actually having anxiety? And then
Yeah.
how does that manifest in kids? And then,
Yeah.
what are some of the root causes for that?
Okay. Sounds good.
So the book starts out talking about shyness,
Right.
and
Yeah.
it makes me wonder, is shyness just like a milder form of social anxiety, or is there
It's a great
a
question.
real difference
Yeah.
between those two?
So shyness is really about being uncomfortable in social situations.
Okay.
And it is rooted in, worry about how we are perceived by others.
Uh-huh.
But it's not necessarily the same as social anxiety.
Okay.
And it's helpful to think of shyness as more of a spectrum. It's not just like one thing.
Gotcha.
And interestingly, psychologist Hans Eysenck actually categorized different types of shyness.
Oh, different types of shyness.
Yeah.
That's interesting.
So he suggested two main subtypes,
Okay.
introverted and neurotic shyness.
Okay.
So introverted shyness is simply, preferring to be alone,
Right.
whereas neurotic shyness involves feeling self-conscious and anxious in social situations.
I see.
So there's a distinction there.
That makes a lot of sense. And that actually reminds me of the example in the book with
Oh, yeah.
Parker.
Right.
He seemed like a real textbook case of the
Yeah.
neurotic shyness.
Exactly. He really illustrates that point well.
Okay.
And it's important to remember that, some people are perfectly content with being shy,
Right.
but for others, it causes real distress
Yeah.
and really affects their ability to function.
Uh-huh.
And that's really when it crosses the line into social anxiety or even a phobia.
Okay. So it's more than just
Right.
feeling a little awkward at a party.
Exactly. It can actually be like a significant
It can be really debilitating.
problem.
Yeah, debilitating for kids.
Wow.
They might experience panic attacks
Oh, wow.
or other really intense symptoms in everyday social situations.
Really?
And what's really interesting is the book gives these specific examples of what triggers these feelings in kids.
Okay.
And it's not always what you might expect.
So what kind of situations are we talking about?
So it can be things like entering a classroom,
Okay.
eating in the cafeteria,
Oh, wow.
attending school dances, or even answering the phone.
Really?
It's really rooted in this intense fear of negative judgment.
Mm-hmm.
So this isn't just stage fright.
Right.
It's like this pervasive anxiety
Yeah.
that can lead to kids missing school, avoiding friends, and missing out on all sorts of typical childhood experiences.
It's kind of heartbreaking to think about kids missing out on those things.
Yeah.
Because of, social anxiety.
It really is.
But it's interesting to know the triggers. Like, what are the things that... Uh-huh.
Actually set them off.
Right.
But I'm also curious about, what are kids actually worried about?
Yeah.
Like,
That's a good question.
what's going on in their minds?
So the book actually cites some really interesting research on this
Okay.
by Silverman, LaGreca, and Wasserstein.
Okay.
They found that school and performance are major sources of worry for kids,
Uh-huh.
especially girls.
Interesting. Yeah, that makes sense.
Yeah.
I mean, even my kid stresses about, being called on in class,
Yeah.
how they're going to perform in sports, all
Yeah.
that kind of stuff.
Yeah, and the research highlights some really specific worries, like being teased,
Okay.
performing well in class, or even worrying about other people's feelings.
Wow.
It really shows how attuned kids are to
Yeah.
social dynamics.
Yeah, I guess at that age, everything
Okay.
is so new and
Right.
you're figuring everything out. So it makes sense that
They're really sensitive.
you'd be really sensitive to those social cues.
Yeah.
Okay, well, we've established that social anxiety can be a real problem for kids.
Uh-huh.
But what causes it in the first place?
Right.
Is it nature, nurture, or some combination of both?
So Kearney presents three main vulnerability factors in his book:
Okay.
biological, generalized, psychological, and specific psychological.
Okay, so let's dive into those a little bit.
Yeah, let's break those down.
Let's start with biological.
Okay.
Are we talking about genetics here?
Yeah, genetics certainly play a role.
Okay.
There's a ton of research looking at twins and family histories of anxiety.
Wow.
And studies show that, if one identical twin has social phobia,
Okay.
the other twin is much more likely to have it compared to fraternal twins.
Okay.
So that suggests a strong genetic component.
So are some kids just predisposed to anxiety?
Well, genes definitely contribute,
Yeah.
but it's not the whole story.
Okay.
It's more to it than simply inheriting those anxious tendencies.
Okay. So then that brings us to this
Right.
generalized psychological factor.
Yeah.
What does that mean?
So this is where the concept of perceived control comes into play.
Okay.
Kearney suggests that children who feel like they have limited control over their lives,
Uh-huh.
that things just happen to them,
Okay.
are more vulnerable to developing anxiety.
Interesting. So it's not just about experiencing difficult events.
Yeah.
It's also about like how much agency
Exactly.
a child feels like they have.
It's about their sense of self-efficacy
Uh-huh.
and their belief in their ability to influence their own outcomes.
Oh, sure.
And this ties in closely with the specific psychological vulnerabilities,
Okay.
which are largely shaped by learned experiences, particularly within the family.
Family dynamics are always so interesting.
Yeah.
So what role do they play in,
Right.
the development of social anxiety?
Well, think about it. Children learn a lot by observing their parents.
Mm-hmm.
So if a parent consistently models avoidant behaviors,
Okay.
the child might learn to do the same.
I-
For example, a parent who dreads public speaking might unknowingly pass that fear onto their child.
So a child's environment and like the
Right.
behaviors that they're exposed to can really
Yes.
impact their own anxieties.
It all contributes.
So it sounds like there's no like single cause
Right.
for social anxiety,
It's a multifaceted issue.
but rather like this complex interplay of factors.
Exactly. Which means there's no quick fix.
Yeah.
You know, addressing social anxiety requires this holistic approach
Mhm.
that takes into account all of these contributing factors.
That makes sense.
Yeah.
It's such an intricate interplay of factors that must make treating social anxiety pretty tricky.
You're absolutely right, because there's no single cause.
Mhm.
There's no magic bullet solution either.
Right.
Treatment often involves this combination of strategies tailored to those different vulnerabilities.
So what does that actually look like
Yeah.
in practice? Like what are the tools
Yeah.
that therapists use?
It often starts with psychoeducation. It's about helping kids and their families understand what social anxiety is, how it works, and why certain treatments are effective.
Mhm.
You know, it's all about laying a solid foundation for change.
So like providing the map before you embark
Exactly.
on the journey of recovery.
That understanding can be incredibly empowering.
Gotcha.
And then there are somatic management techniques,
Okay.
which can be especially helpful for kids
Mhm.
who experience those intense physical symptoms of anxiety.
Can you talk about somatic management techniques?
Yeah.
A little more? I'm not super familiar with that.
So somatic management focuses on controlling the body's response to anxiety.
Okay.
So techniques like relaxation training,
Uh-huh.
where kids learn to tense and release different muscle groups,
Okay.
or breathing retraining, where they practice slowing down their breath,
Uh-huh.
can help them regulate their nervous system and calm down.
That sounds super helpful.
Yeah.
Especially for kids who feel like their anxiety is totally out of control. But what about the thought patterns
Oh, yeah.
that contribute to social anxiety?
Those negative thought patterns are a big part of the problem, and that's
Huh.
where cognitive therapy comes in.
Yeah.
It's all about helping kids identify and challenge those distorted thoughts that are fueling their anxiety.
Can you give me an example of like a distorted thought
Yeah.
that a kid might have?
Absolutely. So imagine a child who's anxious about giving a presentation in class.
Mm-hmm.
They might think everyone is going to laugh at me if I mess up.
Okay.
Cognitive therapy helps them examine that thought.
Right.
Is it really true?
Yeah.
What evidence supports it?
Yeah, it's probably not true at all. And even if someone did laugh,
Exactly.
it wouldn't be the end of the world.
It's about helping kids challenge those negative thought patterns and develop more realistic and balanced perspectives.
Okay.
But sometimes it's not just about the thoughts.
Yeah.
It's about having the social skills
Right.
to navigate those tricky situations.
So does therapy address that as well?
Yeah. Social skills training
Okay.
can be a vital part of treatment.
Ah.
It might involve modeling, where the therapist demonstrates appropriate social behaviors,
I see.
or role playing,
Mm.
where the child practices those behaviors in a safe environment.
Okay.
You know, they can receive feedback and coaching to build their confidence and
Right.
learn new ways of interacting.
So if a child is struggling to initiate conversations,
Yeah.
they might practice, different ways to
Yeah.
approach someone.
Exactly.
Like
It's like
cookie
giving them a toolbox of social strategies
Oh,
to
wow.
use in real life situations.
You made that analogy.
And then there's one more key element of treatment that Kearney discusses,
Okay.
and that's exposure therapy,
Okay.
which is considered by many to be the most effective tool for overcoming anxiety.
Exposure therapy sounds a little intense.
It can be.
How does that work?
It's about facing your fears head on, but in a gradual and controlled manner, so the child is systematically exposed to the situations that trigger their anxiety,
Okay.
starting with less scary ones
Mm-hmm.
and gradually working up to more challenging ones.
I see.
The key is to stay in the situation long enough for the anxiety to decrease,
Mhm.
teaching the brain that the situation is not as dangerous as it perceives it to be.
So if a child is terrified of speaking up in class,
Yeah.
exposure therapy might start with something like making eye contacts with the teacher,
Right.
then progress to answering a simple question,
Exactly.
and eventually, participating in a discussion.
Yeah, it's about retraining the brain's fear response.
Gotcha. So you're slowly
Oh.
desensitizing them.
Yeah, and this process can be done in individual therapy,
Uh-huh.
but group therapy can be especially powerful for social anxiety.
Okay. Well,
Also, it provides a safe and supportive environment where kids can practice their skills and face their fears alongside others
right.
who understand what they're going through.
Yeah.
It creates a sense of camaraderie and shared experience.
So the book focuses a lot on treatment,
Mm-hmm.
but I'm curious about prevention.
Right.
Is there anything that we can do to stop social anxiety from developing in the first place?
That's a great question, and one that researchers are increasingly interested in.
Okay.
While there's no guaranteed way to prevent social anxiety,
Uh-huh.
there are things we can do to minimize the risk.
Okay.
Early identification is key.
Okay.
If we can spot signs of behavioral inhibition or social anxiety in young children,
Uh-huh.
we can intervene early and provide support before it becomes a more serious issue.
So it's about being proactive
Absolutely.
and attentive to those early signs.
And creating supportive environments
Yeah.
where children feel safe to be themselves,
Yeah.
where they're encouraged to try new things and take social risks without fear of judgment.
That makes sense.
This might involve fostering supportive family dynamics, creating positive school environments, and even implementing programs that teach social skills and coping strategies.
So it sounds like a multifaceted approach.
It's involving parents, educators, mental health professionals,
Everyone working together
all working together.
to create a safety net for children who might be vulnerable.
Uh-huh.
And there's actually evidence that parent education programs
Okay.
can be particularly effective in equipping parents with the knowledge and skills to support their anxious children.
Interesting.
It's all about breaking the cycle of anxiety and building resilience.
That makes a lot of sense. But what about the challenges?
Yeah.
What are some of the difficulties that therapists face when they're working with kids
Right.
who have social anxiety?
One of the biggest hurdles is often avoidance.
Okay.
It's understandable. Kids with social anxiety want to avoid anything that triggers those feelings of discomfort,
Right.
but avoidance only strengthens the fear.
It's like the more you avoid it,
Exactly.
the scarier it becomes.
It can make engaging kids in therapy and
Yeah.
encouraging them to do the work of exposure very challenging.
So how do therapists overcome that hurdle? It requires patience, creativity, and a strong therapeutic relationship. Sometimes starting with smaller, less threatening exposures can be helpful.
Okay.
Using a playful approach incorporating games or humor into therapy can also make the process less intimidating.
That makes sense.
It's about finding ways to make therapy engaging and less daunting.
Are there any other factors that can complicate treatment?
Comorbidity is another significant challenge.
Okay.
It's very common for kids with social anxiety to have other mental health conditions like depression, generalized anxiety disorder, or even school refusal.
So it's not just treating social anxiety
No,
in isolation.
You have to address the whole picture,
Uh-huh.
considering all the co-occurring issues,
Gotcha.
which can make treatment more complex.
And what about family dynamics?
Yeah, family dynamics can also play a role.
Okay.
Sometimes parents might unintentionally reinforce their child's anxiety
Oh,
by being overprotective or accommodating their avoidance behaviors.
So part of the therapist's role is to kind of educate the parents as well.
Exactly.
Give them tools to help.
It's about empowering both the child and the family to manage anxiety and create a more positive and supportive environment where growth and healing can occur.
It sounds like a rewarding,
It is.
but also like incredibly demanding
It can be.
field of work.
Yeah.
So we've delved pretty deep into the complexities of social anxiety.
Right.
But I'm curious about like the gaps in our understanding.
Yeah.
What are some of the areas where more research is needed?
Definitely, while we've made significant strides in understanding and treating social anxiety, there's still much to learn. For instance, there's a growing interest in understanding the impact of technology and social media
Oh,
on social anxiety in young people.
yeah, that makes sense because it's like this whole new
It's a whole new
landscape of social pressures and
Right.
comparisons
Exactly.
that could really, exacerbate the anxiety
Yeah,
for vulnerable kids.
Absolutely. More research is needed to understand how social media use might be contributing to social anxiety
Mm.
and what we can do to mitigate those risks.
So what are some of the other areas where more research is needed?
Another area that needs further exploration
Okay.
is the development of more personalized treatment approaches.
Personalized treatment, what does that mean?
So right now we have a set of tools that work well for many children,
Huh.
but just like any health condition, one size doesn't fit all.
Right.
We need to become better at tailoring treatments to meet individual needs,
Okay.
taking into account factors like age, gender, culture, and the specific anxieties each child faces.
So moving away from this one-size-fits-all approach
Exactly.
to something more
More targeted and individualized.
nuanced and targeted.
And that involves understanding the specific mechanisms that drive social anxiety in different individuals.
Uh-huh.
Maybe certain kids benefit more from cognitive techniques,
Right.
while others respond better to behavioral approaches or a combination of both.
So it's really about finding the right approach
It's about finding the most effective approach for each child.
for each individual kid.
Yeah. And this is where fields like genetics and neuroscience can play a significant role.
Okay.
Imagine looking at a child's genes
Uh-huh.
or brain activity
Wow.
to determine the most effective treatment path.
That sounds super futuristic.
It's still early days,
Yeah.
but that's the direction research is heading.
It sounds like the future of treating social anxiety is going to be like very high tech.
It is, and all these advancements are giving us more tools to help kids overcome social anxiety and thrive.
That's awesome.
That's what makes this research so exciting.
It's amazing to think that, we might be able to like personalize treatment
Yeah.
for social anxiety on such a granular level.
It's really exciting.
But before we get too far ahead of ourselves,
Right.
I want to know more about like
Yeah.
what research has already uncovered, like what's happening in the brains of kids
Okay.
with social anxiety.
So researchers have found that certain brain regions, like the amygdala,
Right.
which processes fear and emotion,
Mhm.
are more active in people with social anxiety.
So even in like relatively normal
Yeah.
social situations,
Yeah.
their brains are like on high alert.
Exactly. And this heightened activity in the fear centers of the brain can explain those physical symptoms we talked about earlier.
Right.
The racing heart, sweating, and feeling overwhelmed.
Yeah.
It's as if their bodies are constantly reacting to a real threat,
Right.
even when they're just chatting with someone at a party.
It must be so exhausting.
It can be.
To feel like you're in a constant state of fight or flight.
Right. And beyond that, research suggests that people with social anxiety
Okay.
might process social cues and feedback differently.
How so?
They might misinterpret facial expressions or tone of voice,
Huh?
perceiving negativity where none exists.
I see. So that would like obviously contribute to
Yeah, it fuels their anxiety.
it leads to more avoidance and makes it even harder to,
Exactly. Creates a vicious cycle that can be hard to break.
So if we can like pinpoint these brain differences, is there a way to actually like change them?
That's the big question.
Yeah.
And thankfully, research is showing promising results.
Okay.
Therapies like cognitive behavioral therapy, or CBT,
Okay.
have actually been shown to change brain activity.
Wow. So therapy can like actually rewire the brain.
It really is.
It's incredible.
And this is where the concept of neuroplasticity comes in.
Okay.
It's the idea that our brains are constantly changing and adapting in response to our experiences.
So by like repeatedly exposing ourselves
Right.
to, those anxiety-provoking situations in a safe and controlled setting,
Yeah.
we can teach our brains to like,
Exactly.
Brilliant.
We're essentially creating new neural pathways, new ways of thinking and responding to social situations.
That's amazing.
It offers real hope for lasting change, not just a temporary fix for the symptoms.
That's super encouraging.
Yeah.
So this research into the brain is probably leading to some like exciting
It is.
new treatment options.
There's growing interest in non-invasive brain stimulation techniques like transcranial magnetic stimulation, or TMS.
Oh, I've heard of that.
Yeah.
That uses magnetic pulses to like
Right.
stimulate specific areas of the brain.
Exactly. And early research suggests that TMS may be helpful in reducing social anxiety symptoms by directly influencing the activity in those overactive fear centers.
So it's like giving the brain a little nudge
That's a great way to put it.
in the right direction.
And another promising approach is neurofeedback.
Neurofeedback, what is that?
So it's a type of biofeedback
Okay.
where people learn to regulate their own brain activity in real time.
Okay.
So they receive feedback on their brain waves through visual or auditory cues, allowing them to see and adjust their brain activity as it's happening.
That sounds so futuristic.
It does sound pretty wild.
Like something out of a sci-fi movie.
But it's rooted in solid science.
So you're telling me people can, like,
Yeah.
watch their brains on a screen and learn to control them?
And studies show that neurofeedback may be able to help people with social anxiety learn to calm down those overactive fear responses.
So we've got, like, the traditional therapy. We've got, like, brain stimulation.
Yeah.
We've got neurofeedback.
It seems like the future of treating social anxiety is becoming quite high-tech.
It really does.
And all of these advancements are giving us more tools to help kids overcome social anxiety and thrive.
That's what makes this research so exciting.
Yeah, absolutely.
So it sounds like we've really, explored the depths of social anxiety in this deep dive. We've gone from, understanding the causes and symptoms to looking at current treatments and, like, future possibilities.
Absolutely.
What's the one key message you want our listeners to take away from this episode?
I think for me, the most important takeaway is that social anxiety is a real and treatable condition. It's not a sign of weakness.
Yeah.
And there is absolutely hope. With the right support and interventions, kids can overcome their social fears and build fulfilling, connected lives.
Yeah, that's a great message.
Yeah, so if you're a parent worried about your child, or even if you struggle with social anxiety yourself, know that you're not alone.
Yeah.
There is effective help available.
So reach out to a mental health professional.
Yes.
Get informed, and don't give up hope. There's a path forward for everyone.
Couldn't have said it better myself.
Well, that is a perfect note to end on. I think we've covered so much ground today,
We really have.
From understanding what social anxiety is to, like, exploring, cutting-edge treatments and the importance of prevention.
Absolutely.
I hope our listeners feel empowered to, like, take what they've learned and use it to support themselves and the young people in their lives. So just remember, social anxiety doesn't have to define anyone's future.
Right.
There is a bright future waiting on the other side of those fears.
I agree with that.